Where are my pen? My pens. Let me see, guys. Where did I put my pen? Second time I lost my pen. Oh, yeah. Oh, it's here. Okay, so I thought about maybe do something different today. I'm gonna talk about the leg, the lower limb, and then let me just move this up. I hope you're doing well so far. Okay, let me close this, this, and then this. Okay. And I don't need this, at least for now. What I want to cover is the lower limbs, and I'm gonna try to represent the lower limbs in different ways. No. Let me see, limbs. Also, no? Hey guys, welcome. Just looking for the lower limbs. Neuroanatomy. Hi Veronica, how you doing? Hi Andy, hi Anya, Veronica, Noemi. Doing Veronica? I'm gonna draw something now, but I'm just looking for a reference before I start. So how are you doing, guys? So far so good? Yeah, Anya, message retracted. Wow. Not sure what happened. So this is one of my drawings, one of the drawings I made a few days ago. Yeah, I was talking about the different areas of the head, the face, but I'm gonna cover now. I will still come back to this topic, but I'm gonna make a different move. So what I'm gonna do, I'm gonna talk about the lower limbs. Thank you, Veronica. What do you guys do actually? Tell me a bit about yourself, your background. I'm not sure if you mind, but I would like to know more about you guys. Do you study? Do you work? Are you more interested in the artistic part of this life, or are you more interested in the anatomical aspect of this life? So good. What do you do actually? Do you work? Do you study? Oh, I can't believe the battery is dying already. Last few days, the battery of my phone is just dying so fast. Let me just check. Just a second, guys. I need to grab the cable. And then this. Veronica, do you study, Veronica? What do you do? Share. Tell me a little more about yourself. Do you study? Do you work? Thank you, guys. If you can hit that like button, it will be really helpful. Can you see this like button here? If you can do this for me, it will be great. Now, table of muscle joints. So I mentioned that we are going to learn about the lower limb, no? So let's cover the lower limb. I don't want to take too long because it's already late and I intend to sleep earlier, to be honest. I also have to teach. I think that this one will work very well. Thank you for the 2 likes. Thank you, guys. I really appreciate your support. It means a lot, actually. So, sorry for it's not professionally, to be honest. It's actually really bad, but it is what I have for now. Once things start to get better, I intend to buy a small table for me to do all of this. Right now, as you can see, I am doing this on the floor. Okay, so here. Okay, lower limb. Okay, about the lower limb, guys, before I start, the lower limb it can be divided into the pelvic girdle and the leg, okay? And the pelvic girdle consists basically of the sacrum, the 2 hip bones, and the leg will be divided by joints into the thigh, by joints into the thigh, the lower leg, and the foot. Now, the lower limb will function as a locomotor supporting organ, okay? A locomotor supporting organ. And the long bones of the legs will enable this length of stride to accelerate the locomotion. When you will notice that the joints of the lower limb, they are basically reinforced by stable ligaments, and this will ensure that we all of us we can ensure that we keep the upright position or upright stance if you prefer. And it will also help to reduce the load of the muscle groups in the buttock, knee, and calf region, which have an important support function. and the human foot will act to stabilize the upright stance. And in contrast to the hand, if you compare with the hand in the future, when I talk about the hand, the muscles of the foot, they are less involved in those fine movements that you see, like those that we used to do when we draw, when you play an instrument, or when we manipulate specific objects. And they will be much more involved in the stabilization of the body. And you will see that in the foot we have a specific arches. During this, probably not during this lecture today, but during the next few classes that you are going to see here, you will notice that the arches will be important to support the function of the locomotion, the stance, and the muscles of the lower limb, will be innervated by two nerve plexus that are basically they are joined in the plexus lumbosacralis, or the lumbosacral plexus in English. And the plexus are fed by the anterior branches of the spinal nerves from the spinal cord segments, like the T2 to S5. And there are different nerves to the pelvic girdle, okay? The perineal and the gluteal regions and the legs, the nerves will emerge from the plexus lumbosacralis, if that makes sense. The lower limb is primarily supplied by the anterior and the anteriorly, I forgot the name. Okay, just skip this one. And there, what else? The lymphatic vessels will largely run along the veins and are connected to the lymph nodes of the groin, which also drain the abdominal wall, including the external genitalia and certain pelvic organs. Now, during this part of the video, I'm gonna present the name of basic principles of limb development and the clinical and the relevant clinical variations and malformations. And I'm gonna describe the bone structures of the pelvic girdle and the leg, as well as the joints and motion, range of motion on the skeleton. And I also intend to explain the course of the ligaments on the joints and its origins as well. Origin, insertion, or the attachment, and the function of all the muscles of the hip, thigh, and the lower leg. And also show this on the skeleton and or the drawing that I'm gonna show you here. And what else? I also intend to describe the structure of the plexus lumbosacralis and explain the symptoms associated with the plexus lesions, and describe the course, the function, and the precise symptoms associated with the nerve lesions in the lower limb, and show this on a dissected illustration. And maybe if we have time and if I have enough space, specify the name of all the arteries of the lower limb with their most important branches, and identify them on this illustration. And what else? Maybe for medical students, present the specific locations for pulse measurement and explain the vascular anastomosis in the hip region. It's important that you, along this class, understand the basic principle of the venous flow in the lower limb and the name of the large epiphyseal veins, and show and show them in the illustration here. If you are doing an illustration, show in your own illustration and be able to explain the principles of the lymph flow in the lower limb. It's important to also understand and explain the regional lymph nodes of the leg and the pelvis with their drainage areas. Any other thing? Probably also talk about the borders and contents of the lacuna musculorum and lacuna vasorum, and explain content and the structure of the femoral triangle, which is an interesting area that you're going to learn during some of my drawings here, some of these illustrations. You will also learn about the gluteal region, and you will learn how to identify the neurovascular structures passing through the foramina suprapiriform and infrapiriform, and or the foramen ischiaticum, ischioforamen minus, and explain the structure of the popliteal fossa, okay, and the arrangement of the neurovascular path that will cross this area. All good, Grayson. How are you doing? Where are you from? Okay, let me start with a very simple drawing. Sorry guys, I know that the light is not helping here. Yeah, I'm gonna draw now actually. But I made a few drawings before. You probably just watched the videos, but yeah, if you already watched it, you probably know. You know. And sorry guys, it's just because I'm in a new setup. So it's not like the one of before. So let me know about you guys. Do you draw? Do you like anatomy? You don't like anatomy, but you have to study anatomy? Well, this is something that happens. People don't like, but they have to study sometimes. Okay, so I already have the foot here. And what I'm gonna do is just complete the foot. It's not a nice foot, but I was thinking about drawing the genitalia, but it will not be nice here. Especially because I know that I have a lot of people that are young watching this live. They usually come to watch this live, so yeah, common sense, no? So here we have the lower limb, we have the thigh, we have the leg, and we have the foot. Now we have some landmarks, specific areas that you can identify over the skin. You don't need to dissect the body to see these areas. Well, some people you will not, in some people you will not be able to see these areas because of the excess of fat tissue. But mostly you will be able to see. Okay, let's start with this one. This one is the regio inguinalis, inguinal region. Okay, regio inguinalis, or inguinal region. And here you're going to find the inguinal ligament, or in Latin, ligament inguinalis. Or inguinale. Okay, we have this structure here. We have this landmark right here. Then we have another one here that's usually palpable over the clothes. You can palpate this area, which is the anterior spine, ASIS, anterior spine. Yeah, anterior spine, iliac spine, anterior. I'm just yeah, I just spina iliac anterior superior, or the anterior iliac, anterior superior iliac spine, ASIS. Okay, yeah, ASIS. I was trying to remember in English. Sometimes you need to be patient. So here we have the muscle tensor fascia, or fasciae latae, which is TFL. Okay, TFL. Then we have the trochanter major. Trochanter major is the bone protuberance that you are going to find when you palpate the femur over the skin. Now, this is trochanter major. Let me see where I'm going to write. I'm going to write here. Trochanter major. And then I'm going to put femur. Okay, trochanter major of the femur. And then we have the regio femoris anterior. Regio femoris anterior, which is the anterior femoral region. This one I'm gonna write here. Regio femoris anterior. Regio femoris anterior. And then we have the sartorius muscle. Sartorius muscle will be probably here. Okay? Muscle sartorius. Then we have the quadriceps femoris, which I'm going to do this. Quadriceps femoris. Muscle quadriceps, femoris. Here, if you palpate your knee, you're going to find a bone that is, well, let me just show you guys. Sorry, hairy leg. So we have this bone here that's palpated. You can palpate this bone. Oops. Can you see, guys? I hope so. I pressed something here that I shouldn't. Okay, back to the normal. Okay, we have this bone, radio genus anterior, or the patella. Radio genus anterior. Patella. Okay. And the caput fibulae. The head of the fibula, which I'm going to put here. Caput fibulae. And what else? We have here, oh, this part is quite interesting because some people will have a prominent area here, a protuberance, a bone protuberance. That's called, all of us we have, but some people will have more protrude. This is the tuberositas tibiae, or tuberosity, tibia, yeah. And then we have the regio cruris anterior, this one here, regio cruris anterior, and the marrow of the tibia, or anterior margin of the tibia. Mago anterior. Why I am writing right now in Latin? Because Latin is the, let's say, the universal language of anatomy. I can tell you in English, but, and I'm trying to translate a few words, but the majority of the universities in Europe, they used to teach in Latin, which I believe that is an efficient way. It should be this in any part of the world. Then we have the malleolus medialis. Malleolus medialis. Tibia. And here we have the planta, the dorsum pedis. Let me just write the malleolus lateralis. So we have the malleolus medialis and the malleolus lateralis. And you will notice that malleolus lateralis is lower than the medialis. If you touch the malleolus, you will notice this, which is this bone here. Okay, and then we have the dorsum pedis, and the digitis. And when I talk about the digitis, I'm actually mentioning the 4 digits and the hallux. The hallux is basically the big toe. Okay, so here we have the surface anatomy of the lower limb. And tomorrow I'm gonna show you the posterior part of the surface anatomy of the lower limb. Guys, I have to go now. I really appreciate your time here with me. Thank you for the likes. Thank you for spending part of your time this evening with me. And tomorrow I'm gonna be back sharing more of this content with you. We are going to review this part here, and we will also learn why it's so relevant to understand the surface anatomy of the lower limb. It's important to understand why should I learn the surface anatomy of the lower limb? Well, if you are an artist, you can use this to improve the knowledge of the anatomy, human anatomy. Well, thank you so much, and next time.